No matter what I'm about to tell you about public-private partnerships, I promise that I didn't hear it first from Michelle Obama. I'm Richard Fort. I'm an architect with Clark Nexon Architects and Engineers, and I work in our Asheville studio. At last year's Energy Summit, we spoke to you about the designing of the Henderson County Health and Human Sciences Building. I'd like to walk you through the unique partnership, public-private partnership, that made this project possible. Henderson County was looking for an economic catalyst. They were interested in having a university locate a satellite campus there in Henderson County. Wingate University came on board. Next, the city of Hendersonville contributed the real estate that was required for the project. Then, Pardee Hospital decided to locate a cancer center in the project. Blue Ridge Community College relocated their health science divisions in the project. And then finally, Clark Nexon came on board as a partner to lend the expertise to morph disparate programs into bricks and mortar. The partnership had a vision. Stakeholders worked together and they worked hard. Juggling budgets, programs, priorities, and schedules was challenging. But everyone's wish list is addressed in a collaborative solution that will be completed in September. It's currently open. Some are occupying the building today, but it'll be fully complete in October. These diverse stakeholders all came together, creating interdisciplinary synergies that would not have been possible if they had all gone and built their own project in separate locations. Additionally, $18 million worth of annual revenue is estimated. And these exciting outcomes are two of the reasons that we believe public-private partnerships should be in everyone's future. Now let's compare the partnering approach to the typical approach that we take to campus construction. As campus needs arise, we envision solutions to address those needs. Funding is often out of reach. Our UNC system largely depends upon the General Assembly and every 12 years or so, a bond referendum. This process works, it produces successful outcomes, but it takes time, and sometimes needed projects go unbuilt. The benefits to partnering are obvious. However, there are challenges. Partnering requires leadership, especially when budgets are stretched, egos are bruised, and compromises are called for. Partners must trust each other, that each one of them will get where they need to go, and that working together, much can be accomplished in a short amount of time. And saving time is indeed a benefit of partnering. The Henderson County project was built in a third of the time that it likely would have taken a typical delivery method to deliver. Rather than wait a number of years to secure funding for separate projects, creating a public-private partnership can help us get our projects built much sooner. And saving time is saving money, and saving money is sustainable. And sustainability is probably my favorite advantage to a public-private partnership. Constructing one collaborative campus in lieu of 3 separate projects is substantially more sustainable. Are there mutually beneficial opportunities in your community or creative funding sources that might dovetail with your own? I think it is definitely worth a look. Higher ed construction will increasingly depend upon creative funding sources that can build less and serve more. As we've seen in Henderson County, P3s save time and money, facilitate interdisciplinary interactions, and are more sustainable. Forging such partnerships as these has been exciting, and I believe is a blueprint for the futures of our campuses and communities. That's about it from 24,000 feet. I'm a little short. I've got plenty of time in case there are any questions or if someone would like to get the box out. If not, okay. Do we have any questions? Mike? Actually, the way this particular partnership worked, the Henderson County built the building and then leased it back to a private university, a private hospital, and a public college. Correct. Thanks, you guys.